Dear colleagues, my name is Krzysztof Narkiewicz. I live and work in Gdańsk, the northern part of Poland. On behalf of Professor Andrzej Januszewicz, the co-president of the Congress, the Program Committee, and the Council of the European Society of Hypertension, it is my great pleasure to share some insights of the upcoming Congress of the European Society of Hypertension. Last weekend of May, we meet in Gdańsk, a Hanseatic city, very rich history, but also very modern and vibrant place. This is the venue of the Congress, the Amber Expo, next to the stadium where the European Championship in soccer were held in 2012. The good news is that the city will provide special way to get from the old city to the venue. We'll have the dedicated train service exclusively for the Congress, which is just one stop from the central station to the venue. The main theme of our Congress is about innovations. Innovations not only in hypertension, but in cardiometabolic management. We'll talk about next generation diagnostic tools, biomarkers, wearables, advanced imaging, the progress in pharmacotherapy of hypertension and associated disease, advances in device therapies, drug combination, team-based hypertension management as a new standard of care. This will be the main topic of the ESH 2027 Congress in Basel, but of course we'll address this also in Gdańsk. And of course, finally, we cannot avoid digital transformation, AI, big data, and the future of cardiovascular health. Beyond innovation, the two main themes of the Congress will be clinical care. So we'll have a clinical track and basic research track. This is the plan of the venue, the baseline level. So you enter here from the train. And in the central hall, we'll have the e-posters, we'll have the exhibition, and three main rooms are just next door. It'll be extremely easy to navigate. Blue room, red room, and yellow room. Blue room will be a base for innovation track. Red room, clinical track, and yellow room for basic research. Same level, we'll have a very innovative form of education, patient journey. I will provide some details in a moment. On the top of those three large rooms, there are three smaller rooms upstairs, so we will use 6 halls for the Congress. You will have a choice of more than 120 sessions, including 16 sessions organized by working groups on Thursday. Session Hypertension 2035, so we'll talk about the future, organized by young investigators. 31 sessions across the innovation, clinical, and basic research tracks. 10 sessions jointly organized with other societies, 2 hotline clinical trial sessions. For the first time, the results of major trials will be presented in Gdańsk. 20 oral original research sessions with additional mini lectures included in every session. 32 poster sessions, 21 sponsor sessions, 7 hands-on sessions. I think a very important component of the Congress, the practical aspects of hypertension and cardiometabolic management. Patient journey, this innovative way of teaching, exploring hypertension and other associated diseases in a special place. Meet the expert hub, so smaller meetings for about 100 participants that you could talk to the experts. And for the very first time, we will plan early innovation village. So for startups, for those who are coming with new ideas, there will be a special dedicated place with small booths and a kind of laboratory space to present the prototypes of some of the devices. So let's go very briefly to the program outline. I know that looks very, very busy, the program, but I think it will be quite important to realize what we plan to show during the Congress. So we start on Thursday at 10 with the welcome session, and then you will have three slots associated with the presentation of the working groups. Before lunchtime, we will present 5 sessions covering different aspects, starting from blood pressure assessment, adherence, childhood hypertension, the link between obesity and hypertension and large arteries. Then we will have 2 sponsor symposia, but 3 more sessions organized by the working groups. This time, the patient with impaired cognitive function, one of the sessions, renal denervation, cardiac damage. In the afternoon, 5 more exciting sessions, chronic kidney disease, endocrine hypertension, environmental pollution, microvascular aging, and managing hypertension and cardiovascular risk in low resource setting. And the final slot in the late afternoon, 3 more sessions organized by the working groups. For the first time, the primary care setting, so the family medicine, women and blood pressure and cardiovascular disease, and cerebrovascular sessions. I would like to draw your attention to a very special session organized by young investigators, Hypertension 2035. Those sessions will be followed by the opening ceremony, very special event with very special guests. And afterwards, the City of Dice will invite all of us to get together. So please reserve Thursday evening for special opportunity to meet old friends, to meet new friends, and enjoy the beauty of the Gdańsk surrounding. So let's go to Friday and Saturday. I know the program looks very busy, but let me guide you through the program. So we will have, as I mentioned, 3 main tracks: innovation, clinical track, and basic research. So the blue room, as you can see, will have 4 sessions related to innovation on Friday. We have several sessions in the red room and clinical track, but also the purple room will be used for this purpose, and yellow room, 2 exciting sessions related to basic research. On the top of this, we'll have in the orange room hands-on session, 3 sessions on Friday, 3 sessions on Saturday, and 1 session on Sunday. Then meet the expert hub with smaller meetings and patient journey in a special large space. So if you go to the morning slot, we will have original abstract presentation, but also clinical cases. We'll have 3 sessions with clinical cases. They raise always enormous interest. 1 session on Friday, 1 session on Saturday, and 1 on Sunday. Then the next slot, we will have in innovation track, hope, hype, and scope of novel technologies. We will have a session about the phenotypes in the clinical track, aldosterone novel insights from basic research and the basic research track, and a workshop, how to communicate cardiovascular risk. Then we have a slot with 5 mini symposia sponsored by industry, 2 exciting sessions around noon, 1 with keynote lectures and Björn Folkoff Award on Friday, cardiometabolic innovations beyond hypertension, and in parallel, a very special session based on the questions from the patients. Those questions sometimes are not that easy to answer. For example, I have hypertension. Can I start winter swimming? Can I go to sauna? So we collected 30 questions from the patients, and you will have an opportunity to choose 16 of those 30. So you decide what will be discussed in DICE. And some of the questions will be answered on Friday, and some of the questions will be answered on Saturday during the session, Dr. Can I? Then we will have two parallel sessions of major sponsors after lunch and two more slots in the afternoon. So once again, in innovation track, we'll have a joint session with the ESH about novel tools and novel solutions. We'll have the session with the European Association for Studies of Diabetes and the mysteries of microbiome in the basic research. Then a session related to children hypertension. And the last slot in the afternoon, clinical trials, hotline sessions. We collect the results of the new trials. And then four original abstract sessions at the end of the day, e-poster session. I would like to draw your attention to Orange Room. As I mentioned, we'll have three hands-on on Friday, one on renal ultrasound, one on iron hypertension and small arteries. If you go to Saturday, it's somehow similar. We start in the morning with the clinical cases, the original abstracts, then a slot at 9:30, innovations in medication adherence, a session on sleep. In basic research, we'll talk about salt, inflammation, and the skin. Then a future of the trial design, the current new developments in the field, and a session organized by the Polish Cardiac Society Club 30, hypertensive heart disease or something else. Next slot, five sessions organized by industry. Then around noon, once again, keynote lectures. I'll give you some more details in a moment. And the second round of the sessions, Dr. Can I, based on the questions coming from the patients. Then after lunch, two sessions organized by our major sponsors and two more slots in the afternoon. In the innovation track, we'll talk about the progress in lipid glucose and vaccination. We'll talk also about adoption of hypertension guidelines. So it's a session involving several partners and organizations. So the title is What Works in My Country and Setting. In basic research, the immune system and hypertension, driver, amplifier, or bystander. Then we have a session with the Geriatric Society about management in older patients. And the final slot, original answer, but second session related to clinical trials. And finally, posters in the late afternoon. Three more hands-on sessions, one on large arteries, heart imaging, and the sympathetic nervous system. You might think there are many exciting sessions. I will have to choose. The good news that we plan recording of the sessions, so you'll be able to see one of the sessions live, and after the Congress go to the other parallel session. And then meet the expert hub. Some more experts will be around to discuss most important issues related to cardiovascular management. And the second day of patient journey in this last space, supported by AstraZeneca. And then finally, the last day of the Congress. So in the morning, the third session of clinical cases, four more original abstract presentation, the final hands-on session on carotid ultrasound. And then the slot between 10 and 11, we have a joint session with the European Society of Cardiology. We'll talk about cardiovascular disease in young women. We have a PROCON session, risk prediction for all patients, renin-aldosterone ratio analysis for all patients. We have three more mini symposia sponsored by industry. Around noon, two parallel sessions, hypertension space. I think it's very exciting to see the progress in space research, how this might improve the management of cardiovascular disease. So this is a very special session. And in parallel session with the European Renal Association. And the final session, the first session of the Congress, the best of the Congress, will try to summarize what would happen during those 4 days in Gdańsk, those who will be present. You will be able to, in 75 minutes, to get the grip of the most exciting developments in Gdańsk. We provide a special set of slides which might be used after the Congress. Afterwards, Lancia will provide also transportation to the airport and to the railway station. So this was the general overview. Finally, a few words about the keynote lectures. We are extremely glad and happy to have four excellent speakers. Lotte Bjerre Knudsen, who is behind the GLP innovation development, will present exciting lecture, the GLP-1 innovation story. Martine Clausel, her contributions enormous in terms of understanding the role of endothelin, completely changed the way we manage pulmonary hypertension, but also enters now the field of resistant hypertension. So the lecture from dream to reality, improving lives through endothelin-related innovations. And two researchers from Switzerland, Jacqueline Bloch and Grégoire Quentin. Exciting, really exciting research about new ways of neurostimulation, how this might improve cardiovascular instability and tetraplegia and neurodegeneration diseases like Parkinson disease. And Julian Payton, brilliant neurophysiologist, will talk about the progress in modulation of autonomic nervous system. And I think our title is also exciting, giving the heart a taste of its own medicine. We do not plan breakfast sessions, but we consider a sunrise session for those, early birds. We might organize a session on the beach to talk about diurnal profile. So the website is fully operating. You'll be able to explore the program outline, which is released. We collect now the clinical trials, and you will be able to find out all the details about the upcoming Congress. I would like to draw your attention to special rates in terms of registration. If you are a member of the society, of course, the registration is lower. If you present a poster or oral presentation, there's a significant reduction in terms of the fee. And for everyone who is younger than 35, you can see that it's actually only 30% of the regular fee. Will have a really very low fee for those countries with coming from the low and middle income setting. I think very special price for nurses, pharmacists. We would like to attract pharmacists and other healthcare professionals. You can see it's like 10% of the fee. And finally, we would like to attract students who are interested in research to come. You can see extremely low fee for participation in the Congress. So I hope that I convince you that this will be really a unique Congress in I think, a unique setting of Gdańsk. We hope to see you all the last weekend of May 2026.